Kind invitation, and I think congratulations for all the winners for Diabetes Educator Award, and really appreciating your hard work for DAYDEIC 2023. So my topic is foot care in diabetes. It's very close to my heart. Every day we are practicing the foot care. So what is the main goal of foot care in diabetic people with diabetes? The main goal is to prevent the normal foot to become a diabetic foot. So main goal that where the diabetic educator plays very important role to prevent the diabetic foot to become normal foot to become a diabetic foot. As Dr. Gupta really said, ki patient comes later with in two doctors. The first one is the educators will see the warning signs or early detection of diabetic foot problems. So what puts the special diabetic people or people with diabetes in hospital the most? So with the heart disease, stroke, kidney failure, and the fourth one is diabetic foot. So diabetic foot is a very common complication of in people with diabetes. It, with, the most common complications in India, 1 in 6 people with diabetes develop sore, ulcer, or callus in their life. It is the commonest reason for the hospitalization, almost 30% in India. So why is diabetic foot? Because of the painless nature of diabetic foot, because of uncontrolled sugar or long-standing diabetes. One of the complication of the is like diabetic neuropathy. So the patient doesn't feel pain. So it is painless nature of diabetic foot, most ignored and neglected. The most the like largely underreported. Patient comes with us with the second or third stage of diabetic foot. So they never comes with the first stage where, so they think a little wound is there, but they don't know how the internally it is spreading through, and it needs the most self-examinations. But that's why we are neglecting the diabetic foot, but that is one of the most serious complications of diabetes. Everybody knows the prevalence is very high diabetes in India. As diabetes is a non-traumatic long amputation group, with the increasing incidence of diabetes, definitely there will be increasing the diabetic foot complications. But the good news is that the recent report shows that the 70 to 80% of diabetic foot ulcer can heal. The 10% stay active, and 5 to 24% eventually develop into foot amputations. So we have to that 60 to 80% to 90%, the by educating, we can heal the ulcer at the first stage. So there are studies with the 61% of the food ulcer can heal with the proper education, counseling, and the treatment. Precious feet. I mean, we could have prevent these complications. Yes, we could have the prevent this complication with the proper education and the counseling on foot care. There are many studies that if the proper education and counseling is given to the patients in every visit, we can the foot care is the best economical options for the diabetic foot or lower limb amputations. So how diabetic foot ulcer can occur? It's a chain of events because of the long-standing diabetes, uncontrolled diabetes. They develop the complications of neuropathy. Neuropathy causes the loss of sensations, loss of sweat glands. So their feet becomes dry. That can lead to the ulcer, minor injury, and patient continue to walk with the wound. So it could lead to the infections, poor blood supply, and delay in wound healing. And uncontrolled diabetes infection can lead to the diabetic foot complications. So if we want to counsel the patients, we have to counsel at the stage 1 before developing diabetic foot. So our role is to prevent the diabetic foot or any ulcer to come. This is a continue walking because of first they develop the callus and continue to walk because of dry skin. They don't have a pain. It is called, can lead to subcutaneous hemorrhage, breaking of the skin, and deep foot infections. What is the goal of foot care? Main goal is to prevent the injury of the foot because of the flat foot or corn, callus, unfitted shoes, because of if you are not wearing proper cotton socks or a footwear, they develop this injury in the foot. So we have to prevent that foot injury, prevent ulcer, prevent infections, to maintain the mobility of the functions and to save the foot from the amputations. What are the warning signs? That first you look at the patient's feet. If patients complaining about the burning and painful feet, swelling of the feet or foot, loss of sensation to cold or torch, thickening of the yellow and toenails, if they have a fungal infection between the toes, many the adults, they cannot bed down. So after when they come from, especially in the rainy season or after bath, they don't clean their toes, especially in between the toes. So they have a fungal infection between the toes. Any unusual sign like blister, red spots, and ingrown nails is a warning signs. So immediately you have to see that warning signs and refer to the patients or do the first line treatment. The 5 key elements prevention of diabetic foot problem is: first, identify the high risk food, like on the basis of the warning signs, regular inspection or examination of food, educate the family and the healthcare providers, routine wearing of appropriate footwear, treatment of pre-ulcerative signs. So first, in prevention of diabetic foot problems or foot care is first wash your feet properly, dry wear, well, especially in between the toes. Look between the toes if any fungal infections. Cut your nails, the toenails across the straight line. Check for any dry skin or cracked skin, for any formation of corn, callus, and self-examination is very, very important. So daily you check your feet and keep your the mirror downside and check your feet for any unusual signs. And if you find any, immediately report to your consultant. So first is wear the cotton socks compulsory. Preferably it is seamless because it will come between the blood circulations. Do not walk barefoot. Check your footwear before wearing of any sharp objects like pin or any stone. Apply moisturizer cream in front and back side of the feet, but do not apply in between the fingers. If you're applying, make sure it is dry completely. Daily inspect your feet and self-surgery and treatment warning. So do not use the footwear like chappal and slippers. Do not use very hot water, very cool water. Don't soak your feet and never walk barefoot. And don't ignore the warning signs. These are the type of footwear you have to use. Avoid the pointed shoes. You can favor the broad rounded shoes. Slip-ons, no, it's very trendy slip-ons, but then wear any adjustable with the Velcro or buckles. Avoid the open toes. You can wear athletic shoes or walking shoes. High heels, you need to avoid high heels and favor more of the flat feet, the flat footwear, or a footwear which is made from canvas and leather material. Avoid buying too small or exact fitted shoes according to your size. In fact, you should buy in the evening for a new footwear, so you get proper management, and half-inch between the longest toe and extra size from your side. So especially if you find the patients, they have a flat feet, try to advise them to wear a footwear with the arch support so we can avoid the ulcer or corn formations. If you find patient with the fungal infection in the nail, so you can refer to podiatrist, or you can consult, and at least they will start with the antifungal nail liquor, or you can use the Candid B solutions. And if you have a wound also, suppose you have a corn, callus, you can shave it. I mean, diabetic if you are trained, you can shave it yourself. Otherwise, you can refer to podiatrist and wear a silicone cap available. You can available in the any this Amazon and other sites, and available in medical store also. So at least you can offload that. You patient will not have a pain, and you can offload the pressure on particular sites. So offloading is very, very important. When you do the offloading, so you can see the blood flow is not in the affected area. So you get that offloading footwear. So patient can continue to walk in spite of wound, and pressure will not come in that area, and it helps in the faster wound healing. You need to advise the patient like foot assessments, yearly checkup. So for the early detection of the foot ulcers like neuropathy, pressure points, you get that monofilaments or a vibration perception test. So we'll come to know high pressure area. So you can suggest the footwear according to that to prevent the further complications. You get the scanning of the feet. So you get the high pressure area. It will help to design the shoes according to the pressure areas. So these are the common foot care tips like good glycemic control is very, very important. Keep the feet clean and apply moisturizer. Daily foot examination. Use properly fitting shoes and socks. Do not use tight undergarments. And in India, it's very, very common. Like people can sit half an hour or 1 hour in a continue folding your legs in a one position. So try to avoid crossing your legs when sitting for a long time. Never walk barefoot and quit smoking. So follow this protocol, that CPR, care, protect, and refer. So care, foot care is very important. Protect your feet from the unwanted materials, from the corn, the callus. And CPR and refer. If you find any complications, please refer to podiatrist or talk to your consultant. So if CPR is not followed on time, can lead to the worst outcome of diabetic foot complications. So foot care is very much important to prevent in the complication of the foot. So journey begins with the healthy feet. Thank you.